everyone. So my name is Chrissy Chapman, and I have worked in dialysis now for about 17 years. And my voice is a little hoarse because I've been sick all night, so I'll try to talk as loud as possible. I've worked in dialysis in various capacities, but as a financial counselor or coordinator for about 10 years. I was on dialysis for 2.5 years, and I transplanted 10 years ago. So I've been on both sides of the line. So I feel a particular connection to dialysis patients and the advocacy part of it. So when I work with patients regarding their financing options, it's all about the advocacy. So what are the different types of insurance that usually financial counselors or coordinators will talk to you about from the dialysis perspective? It's going to either be Medicare, which is federal, because most dialysis patients end up at some point on Medicare. Medi-Cal, if you qualify, which is your state option. Other government coverage, such as VA or TRICARE for Life, which TRICARE turns into when you get Medicare because it turns out into a supplement. Or your commercial options or your private pay options. Your employer group health plans, your marketplace plans, which we heard about earlier. Off-market plans, which is outside of the Obamacare. And then also for those patients who don't have coverage, your self-pay or no insurance. So I'd like to start by talking about how insurance works in dialysis, because I think you need to understand the big picture to really understand how it's supposed to work for you and to have the best opportunity to make the right choices in dialysis insurance. So based on the type of insurance coverage you have, dialysis companies receive different amounts for providing the services to you. Medicare pays one base rate for dialysis, and it's called the End-Stage Renal Disease Prospective Payment System. Years ago, we used to get paid in dialysis on a per-service line item. So for every little thing that we did, we got paid for that each amount. If we provided a drug, you got paid for that drug. If we provided services, we got paid for services. So we could bill for each individual line item. Well, Medicare said, I think they're overcharging for things. So what we're going to do to make them provide services but help us control the cost as part of Medicare, so we're going to say, on an average, dialysis should cost this much. That's what we're going to pay, and you're going to manage that care of each patient for that amount of money. And if you do a good job, you should manage it for less than that, and that's how you'll make your money going forward. So that's how the ESRD prospective payment system came into existence. So the amount for 2016 is $230.39 per treatment, which is approximately a little less than $36,000 per year. Most patients have Medicare, so this is approximately what a dialysis company will see as Medicare as a primary payer. CMS estimated Medicare will pay about $9 billion to approximately 6,000 dialysis centers for the treatment of ESRD for this year. It's a lot of money. But I want to note that the amount of fee-for-service Medicare payments back in 2011, before this prospective payment system came aboard, was $87,000 because it's very expensive to provide care to dialysis patients. And depending on how stable you are as a patient, then those costs will wax and wane. So if you're freshly out of the hospital, you have a lot of comorbid conditions, it'll cost a dialysis center more money to maintain your care. If you're a very stable patient, you don't have a lot of illnesses, you're not in the hospital, then chances are they can manage your care for a lot less, and it's more profitable for the dialysis company. So how does insurance continue to work in dialysis? Well, Medi-Cal pays less than Medicare per treatment. So I want you to think about that. Medicare only paid $230 on average, and that can go up a little depending on what part of the country you live in, because Medicare does pay more for more expensive areas like the Bay Area, but in Texas it may be a lot less. Medi-Cal pays even less than that, $230. I think on average Medi-Cal pays around $150, and that's if we're lucky, if we're not having problems getting those payments from Medi-Cal, because we do have issues with payment. Other government plans, such as the VA, they pay usually in line with Medicare, sometimes a little more. And then your commercial plans, which is really where the meat of dialysis payments come from for dialysis companies, is from these private pay plans, whether they're employer group plans or off-the-market plans or Obamacare plans. But even within that section of plans, there are different amounts that the companies pay. Some dialysis companies will negotiate with a certain insurance carrier, and so this company, perhaps DaVita, may pay one contracted rate for that exact same plan that another company, such as Satellite or Fresenius, may pay a different amount to that same insurance company, because it's all about the competition of the business. Remember, dialysis is still a business. Yes, we're here to provide care to you, but dialysis is a business. So I want to make that clear when you're deciding your options, that you're advocating for yourself. You have to always remember that your first instinct is to protect yourself as a patient, but not everybody is going to be coming from that perspective. So you want to understand the big picture and how it works. Payment amounts can range from several $100s for treatment to thousands. So this can be a lucrative business, but it's all about how it's managed. So how does insurance work for you? Because that's what's important for you. Medicare pays 80% of the cost of your service. You're responsible for 20% unless you have some other insurance in place. And that can be a Medicare supplement, which we also call a Medigap. It could be Medi-Cal, or it can be some other coverage. So your employer group plan can be secondary. You can have some other private pay plan that is secondary. It just depends on what your individual circumstances are. Medi-Cal pays 100% of the cost of services at a Medi-Cal rate. And I stress that because everybody says, well, it pays for 100% of those costs. Those costs are much higher than what Medi-Cal actually pays. So that's important to understand. And then if you have a share of costs, then it pays even less because you're responsible for that first bit of money that you're required to pay before Medi-Cal will even kick in and pay for your dialysis costs. Other government plans generally pay 100% of Medicare rates also, so we get about the same amount. Sometimes they pay more. Commercial plans vary based on your benefits. So generally speaking, if you have a deductible, you must satisfy that amount before your insurance kicks in. Deductibles, if you have a good insurance plan, I would say in dialysis, $500 is good. Generally, we probably see anywhere from $500 to about $2,500 deductibles. You may have copays per treatment. That's generally $20. I would say the highest I've seen in general is about $50. Copays per treatment. So if you're an in-center patient, you're talking about 13 treatments per month, and that you're going to be responsible for those copays for. So you want to look at those kind of things. Once you meet your annual out-of-pocket, which is the limit you spend for your combined copay, coinsurance, and deductible amounts, then your insurance will pay at 100%. That's also important to understand, because I think a lot of times people, patients read their insurance benefits and it just sounds like a lot of jargon that they don't understand. They don't understand the difference between deductible, copay, or coinsurance, and your annual out-of-pocket. But it's really important. It's your responsibility to ask the questions. It's okay to ask the questions because you have to be responsible for you. And you want to make sure that you're protecting yourself by understanding all of this information. So why is all of this important to me? Because the bottom line, dialysis is a business. And what may be in your best interest may not always tie to what's in the best interest of the company. And a lot of times when you're in dialysis, you have financial counselors and coordinators at the dialysis center, but are they truly advocating for what's in your best interest? Or are they advocating for what's in the best interest of the dialysis company? Hopefully they truly are advocating on your behalf. But to be certain, you need to understand what's important to you and how it impacts you as a patient. So you have to be your own advocate. You have to be informed, and you must do what's best for you. So what are the most important things to know? If you haven't commercial coverage, enrollment or delay in enrollment in Medicare can have financial consequences for you. This is probably one of the biggest things that come up for dialysis financial coordinators is the coordination of benefits period. Basically what that is when you have an employer group health plan, it's required to stay primary for the first 30 months of dialysis when you're entitled to Medicare. During that 30-month period, it's primary whether you enroll in Medicare or not. So if you decide to pick up Medicare, it'll be secondary to your employer group health plan. So if you want to delay, that's fine, but you need to delay both parts A and B. Because a lot of times, the Social Security office, they are familiar with Medicare general information, not necessarily ESRD information. And you'll have representatives that say, oh, you should take Part A, it's free. There's no cost to you, just delay the Part B, because that is This year, it's $121.80. And so patients go, okay, well, you know what they just did? They limited you to when you can enroll in Part B. Because when you don't delay both parts, you can only enroll during the general enrollment period, which is January 1st through March 31st of every year. That makes your Medicare effective July 1st of that year. So it's all these little nuances that people don't necessarily explain, but if you read and understand and hold yourself responsible for knowing the information, you can probe and ask questions when they're giving you information that you might not necessarily think is absolutely correct. Some dialysis patients choose to delay enrollment beyond the end of the COB period, and that's perfectly fine. I've had patients who said, no, I have an employer where this is going to be my plan for life. They told me that it's okay. I never need Medicare if I really don't want it because I'm taken care of. I say, okay, get the name of the person who told you that, write down the date, and make sure you keep it forever because you have to protect yourself when people are providing information to you, whether that's the Social Security Administration, your dialysis financial counselor, the insurance company themselves, because that gives you an opportunity to appeal any decision that is not in your favor. So if somebody tells you that and then you find out your insurance says, well, you have this thing called a Medicare Entitlement Clause. What's that? Well, in our policy, if you're entitled to Medicare but you chose not to enroll, we're going to make you pay for the 80% that Medicare should have been paying because you didn't enroll and we told you in your benefit clause that you were responsible for enrolling. Now you listen to somebody else that told you you don't have to enroll at this time. We're going to take care of you for life. And now you're paying 80% of the costs that should have been covered, 80%, 100% of that 80% should have been covered by Medicare. Your coverage should have covered the other 20%. You would have been set. But you didn't have the information or you didn't understand all of the information that was provided to you and you didn't ask the important questions. So it's always important to know, like, what exactly my benefits entail. Is there a Medicare Entitlement Clause? What is a Medicare Entitlement Clause? Do I have a COB period? Am I in my COB period? When does my COB period end? And it's important to understand all of those terms because they are shot out at dialysis like every day, and it's always the acronyms. So that's why in my presentation I made sure to spell everything out. Keep this information. It's important, and it's always a resource for you. If you have an employer group health plan and you're losing your job, you can apply for COBRA. I have so many patients who told me, well, yeah, I was offered COBRA, but it was so expensive, I didn't even think about it. I said, you need to ask. Like, I understand that there are going to be times where I can't assist you, but the one thing I can do is assist you if you tell me that this is going on. There are organizations such as the previously mentioned American Kidney Fund that have health insurance premium programs that will assist with the cost of COBRA. So at least you keep those benefits in play as long as possible. It allows you to keep your coverage for up 18 to up to 36 months if you get to extended. If you're in your COB period, it extends that coordination of benefits period. So you can still delay your Medicare enrollment if you want, if you're happy with your health care coverage. COB period does not apply to Obamacare or off-market plans because they're considered private plans. COB period only applies to employer group health plans. So that's important.
I can't follow because I don't know what COB means.
Coordination of benefits period.
Okay, and what about EGHP?
Employer group health plan. So in the slide that's also in your folder, it has all of this information, and I spelled everything out, so it's very clear. And everywhere there is something that I noted, I also included the resource, so you can go to that resource as well. So when you delay enrollment, and you're not supposed to delay enrollment, you do have the potential of being assessed a 10% late fee penalty for every 12 months you should have been enrolled and weren't. And this lasts for the lifetime of Medicare, unless you end up with a new enrollment opportunity, such as you're under 65 due to dialysis, but at some point you'll reach 65, you have a new entitlement period. Then that penalty will go away. But if you're already 65, you just cost yourself 10% for every 12 months for the lifetime of Medicare for not knowing the information. Dialysis companies may prefer you remain on a private plan primary if they receive more payment for you having a commercial plan. they may try to encourage you to stay on that commercial insurance and not enroll in Medicare. And you may want to enroll in Medicare because maybe your prescription benefits are super expensive or you have a large out-of-pocket cost. If what's in your best interest is to enroll in Medicare or some other coverage, think about it. And the reason that I bring this slide up particularly is because CMS, or Medicare, the Center for Medicare and Medicaid Services, is currently surveying beneficiaries about this particular issue. It came up recently that companies, a specific dialysis company, was encouraging patients to remain on commercial plans that were more expensive because they got more reimbursement when they were available, when Medicare and Medicaid were available to these patients. And as a result, Medicare found out about it, and now there is litigation in place. And Medicare is trying to find out by surveying their beneficiaries to see, is this happening more widespread, or is this a specific instance where this happened and we can nip it in the bud if we address this one particular case. So it's out there, but you have to be aware that it's out there. Let's see, and he's already talked about losing the premium income tax credit, because you do get an income tax credit if you're on like the Obamacare under a certain income level, but you can lose that if you enroll in some plan, if you enroll in Medicare. Once you enroll in Medicare, you lose that tax credit. Whenever you transition from a commercial plan to Medicare, you want to always know your enrollment periods, because if you miss an enrollment period, you may not be able to enroll again till the next year. So for that, the remainder of that year, you're paying full cost for maybe your drug costs or whatever else you may need as far as services. As far as financial help, like I mentioned, American Kidney Fund has a health insurance premium program specifically designed for dialysis patients, so it's only while you're on dialysis. You have to complete an application. Many patients who don't qualify for other assistance do qualify for this assistance because it's not income-based. It's all about your income to debt ratio. So you should really look into the program if it's something that you're struggling with financially paying for those premiums. Dialysis companies also have internal financial assistance programs. Doesn't hurt to ask, is there something that you can do to help me with the out-of-pocket costs because my insurance doesn't cover all of the costs for my dialysis treatments and I'm receiving bills? Ask your social worker or ask your financial counselor or coordinator, because that's what they're here to do, is advise you on what's available at the dialysis company. You may also have access to low-income subsidies or extra help for your Medicare prescription drug costs. So you can always call 1-800-MEDICARE, and they'll walk you through the process, which is always good. So it's not something you have to do on your own, but you can also go online. If you're really computer savvy, you can do it yourself as well. And I said questions, but save them to the end.